Yield back.
Thank you. The gentlelady yields back. I now recognize the chair of the full committee, Chair Rodgers, for 5 minutes for an opening statement.
There they are.
Yeah. Thank you, Mr. Chairman. There they are, the patient rights advocates. Welcome. Thank you for being here. Yes, welcome to the Energy and Commerce Committee and a very important hearing today. And it is an issue that we are addressing with bipartisan support. I really appreciate the comments of the chairman, the ranking member, as we are focused on driving down the cost of health care. It's a top concern as cost of living has surged. More than 60% of Americans are living paycheck to paycheck. It means they're just one medical bill away from a financial emergency, one doctor visit away from not being able to pay the rent for their groceries or gas. A recent poll of Americans with health insurance found more than half ranked reducing healthcare costs as their top healthcare policy priority. For a more secure and healthier future, people need to have certainty and stability. As the ranking member just mentioned, the United States spends more on healthcare as a percentage of our economy than any other developed nation. And CBO projects that the federal healthcare costs per person are expected to grow faster than the economy, meaning the U.S. will continue to spend more as a percentage of our economy. So I'm pleased that we are working together in a bipartisan way to hold this hearing on what the federal government can do about the high cost of healthcare. Improving price transparency in our healthcare system is one of the ways that we can drive down cost. It's fundamental to restoring the doctor-patient relationship. Right now, it's nearly impossible for patients or their employers to shop for the best and most affordable care they or their employees need. It's nearly impossible for people to plan ahead and budget their healthcare cost. Take, for example, Danny Youngling from South Carolina. She needed a biopsy and had a $6,000 deductible. Her hospital's price tool estimated that she would pay $1,400. After receiving the bill, she found out that the true cost of the service was nearly $18,000, and she was on the hook for more than $5,000. Patients shouldn't be in the dark until after they receive care and their bills come. Now, the Trump administration finalized 2 rules on price transparency. The first rule requires hospitals to post standard charges and payer-specific rates for all items and services and a consumer-friendly display of at least 300 shoppable services like an MRI. The second rule requires insurers to post comprehensive rate information and provide patients personalized pricing information for 500 items and services. That includes a wide spectrum of services, from routine doctor visits and imaging services to more complex care like knee replacements or even delivering a baby. Unfortunately, independent evaluators broadly agree that most hospitals have not complied fully with the rules. We need stronger enforcement at CMS, which to date has only levied 2 penalties against hospitals for not posting accurate information for patients. We will hear from a hospital in my district that is transparent and in compliance with the rules about their experience and why we should have reasonable expectations that other hospitals should comply with these rules. Eastern Washington employers have also been on the forefront of utilizing price transparency for good. Schweitzer Engineering Laboratories in my district, one of the largest private employers in Eastern Washington, has been a leader in utilizing price transparency to deliver better quality care at lower prices. We know from stories like these, if fully implemented, these rules help Americans. A recent economic analysis found that together, both rules could reduce spending for privately insured individuals by tens of billions through 2025 alone, with low-income Americans seeing the most significant benefits. Ranking Member Pallone and I have worked together on oversight for these rules for the past 2 years, and I look forward to continuing that bipartisan work today. Additionally, we will also examine how more competition can help lower healthcare costs. Hospital, physician, and health insurance markets have become increasingly consolidated. Consolidation hasn't just been limited to hospitals buying other hospitals or physician groups buying other physician groups, also known as horizontal integration. We've seen a rise in vertical integration where purchases occur across different sectors within the healthcare system. For example, this could mean hospitals acquiring physician groups or insurers buying PBMs. For patients, this could mean their insurance company may own their doctor's practice, their pharmacy, and the PBM that decides what they pay for medicine. These arrangements in the best interest of patients? It remains to be seen, and one of the reasons why we're having this hearing today. So thank you to the witnesses. We're grateful for your expertise and work, and look forward to having this bipartisan conversation. I yield back.
Thank you. I thank the chair for yielding. The chair now recognizes the gentleman from New Jersey.